Hi everyone, welcome to Nick Barlow Radiology. I'm just going to share a quick case with you that I reported this morning that I thought was quite interesting. If you like the video, please subscribe to the channel, share with your colleagues and drop us a like. And as always, put any ideas for future content in the comments. Well, let's get straight down to it. So this is a patient that presented 24 hours post gastrographing for small bowel obstruction. And we can see here we've got contrast within the small bowel. We know it's small bowel because the loops have tight radius of curvature, and we have faintly here, if we zoom in, we have some very, very small folds to the bowel wall, these valvulae coniventes. So we know that this is jejunum region of the small bowel here. You don't get the valvulae coniventes at the ileum region. So let's come back out of there. So we've got that going on. Very little contrast, if any, is seen within the large bowel. So we can kind of see large bowel coming in here, and transverse colon comes across here. We've got some fecal impaction within the rectum, but no obvious contrast seen within the rectum there. So this is in fitting with the patient's history of small bowel obstruction, but that's not the reason why I'm showing you this case. The reason I'm showing you this case is we can see here, if we zoom in, we have this diffuse calcification of the gallbladder. This is the gallbladder, the structure, and you can see we've got this uniform diffuse calcification of the gallbladder wall. So this is something known as porcelain gallbladder. It's rare. It's seen in around 0.2% of cholecystectomy specimens. Okay, so very rare. And it's basically the term porcelain is used because I don't know if you remember kind of old-fashioned white and blue porcelain plates that maybe your grandma used to have. This is kind of how it looks when it's surgically removed. It's got a kind of bluey, whitish outline to it. Often picked up incidentally, so patients are asymptomatic. And the only concern with this, guys, is that a small portion of these can go on to have gallbladder cancer. I think it's approximately around 6% more, 6% higher probability that these patients will go on to develop gallbladder cancer as opposed to a non-calcified gallbladder. So these patients, if they're asymptomatic, they'll have follow-up ultrasound imaging to see what's going on. They'll have laparoscopic cholecystectomy if they are symptomatic, just because of that sort of increased 6%, and due to the high morbidity and mortality of gallbladder cancer, we don't want to mess about with it. So yeah, I just thought it was interesting, guys, because you don't see many of these in practice, and I thought this was quite a good imaging example for you to be able to refer to. So yeah, if you've liked the video, as I said, drop us a like, and I'll be doing some more in the near future. So yeah, thank you very much for listening. Bye for now.